a didactic that we are going to be recording today. Coming to us from a couple community navigators. So the topic, or the title of the talk is Partnering with Community Mediators to Promote Preventative TB Behaviors Among the Community. And our two speakers are Frankie Era and Mohammed Amkush. Bear with me while I pull up their bios. So Frankie is originally from the Marshall Islands. He's a disease research and intervention specialist with the TB control program for the Seattle and King County Public Health TB control program. Since he joined in 2020, he's been actively involved in community outreach and TB prevention. Initially, he started as a contact tracer during the COVID-19 pandemic, but has since moved on to TB work. And he's doing community outreach to increase community participation and trust in the COVID response and also the TB control program efforts specifically related to LTBI. Mohammed is originally from Iraq, has a pretty impressive extensive education history. He has a BA in literature from a university in Iraq. He has an MA in linguistics from a university in India. He has a PhD from a university in Turkey and a BS from Green River College in IT here in Washington State. He's been, since he moved to the United States, he's extensively worked in the community as a family support specialist, as a homeless prevention specialist, and currently he is a community health worker, working initially in the COVID response, but now again, also in TB. We're very happy to have both of you. I probably didn't do you justice with those introductions, so please do provide context about who you are and the work you do, and please take it away.
All right, thank you. So let me share my screen. Okay. Alrighty. Are you able to see the slides?
Yes.
Perfect.
Yes, we can.
Okay. Alrighty. So, like Bijan mentioned, I'm Frankie Era. I'm a DRIS, or a Disease Research Intervention Specialist with the TB program here at Seattle and King County. I began working with the program around 2021, and at that time was splitting my time with the COVID contact tracing team. The responsibilities of the role with the contact tracing team involved like calling cases to identify contacts, coordinating care, sharing isolation and quarantine guidelines with cases and contacts, facilitating requests for isolations, scheduling testing, coordinating food and other essential requests, just a whole lot of facilitating and coordinating. And so many people were receiving these COVID services, but it seemed like many of our Pacific Islander communities weren't. I remember these concerns being brought up to me by several community leaders, and it seemed like many folks were not aware that the team would be reaching out to them to offer these services. And I think many calls from the team were being ignored. So I expanded my responsibilities to do outreach, to speak with the Pacific Islander communities about the team, and essentially ask folks to not ignore our calls. But I was only aware of these concerns through personal connections with leaders from the communities. And the reason I'm sharing about my time with the contact tracing team is to kind of highlight the disconnect between community and different healthcare organizations. Shortly after that, I started a new role with a new team at the TB program called the Community Prevention Unit to work with community representatives, mainly the Community Navigator program here at Seattle and King County, to do TB outreach. And joining me today is Mohammed, one of the amazing community representatives with the Navigator program. With that, I pass it on to you, Mohammed.
Thank you, Frankie. Thank you, everyone, for having us today. Appreciate the space and the opportunity to talk to you all. This is Mohammed Amkush. I identify as a community navigator. This is my lovely job that I really love on every day. Since I came to the US in 2016 with my daughters and my wife, and it has been such a journey, you know, like as a refugee, you come, just resettlement itself is a process that's so complicated and so difficult. Even if I feel privileged to have to speak English. I still like it's challenging journey. It's not easy to settle in and find resources and things that can benefit the family to be able to thrive. And my personal experience as a refugee, honestly, like it pushed me for this kind of work. Since I joined the community work, I started as a volunteer helping Arabic speaking families and Middle Eastern families in King County with just simple applications. Those who have language access issues, those who don't know how to apply for this or that, families with kids and adults with disabilities, um, uh, people who seniors and youth and everyone who come to the doors of the community center. At that time, I realized this is my dream job. I used to teach. I used to be a teacher in Iraq and in different positions. Um, but I love being with families, talking to people, and responding to the needs that I myself went through. Yeah, and since COVID, I joined a wonderful team of community navigators within public health, Seattle King County. And this team is a very diverse team who, involve community leaders and experts in their communities who are doing the work already. We were asked to to respond to the needs when it comes to COVID and social determinants of health in general. Um, Recently, I joined the TB prevention unit, as Frankie said, working with other navigators to promote awareness about TB. As you know, TB is a tough topic to talk about, but we made it fun. That's how I can say it. In a way, the way we present it, the way we talk to people, the way we drafted our flyer and everything that we did helped facilitate the conversation in an easier way. Yeah, thank you for the opportunity again. And Frankie, should we start?
Okay, cool. Just trying to find my unmute button. Okay, sounds good. Thank you, Mohammed. We both don't have any conflicts to disclose. Okay. Before we start our discussion today, two things. I just want to echo what Mohammed said and express our gratitude to you all for joining today to hear community voices and about our work. So thank you. Second, just as a quick background, as I mentioned, Mohammed and I were part of this newer team with the TB program called the Community Prevention Unit. Our team was created to address LTBI to increase testing and treatment of TB infection. And we're doing this through two approaches. One is through community outreach and engagements, which Mohammed and I will talk about today. And the other is by outreach and engagements with providers and other healthcare organizations. Today, we will share about the work and partnership we have with 17 community representatives and highlight the successes and opportunities of our work. And we'll also be sharing about the challenges we've encountered. We'll start with the 2024 NTCA conference to highlight key trends relating to community engagements. Mohammed and I attended this year's National TB Conference in Baltimore to present a poster abstract of the TB outreach work we've done with Mohammed and his team last year. So, sorry. Here are the key terms that we will be using throughout our discussion today. Yeah, so what stood out to many folks that came across our poster was the success we had in reaching many communities. Folks were very impressed that we were able to consistently engage 17 communities. The list are here in the results area section. In 2023, engagements with these communities were through tabling at more than 400 resources and health fairs, monthly tabling at four health clinics, and 10 community presentations. We learned and we observed some trends relating to community engagements during the poster and the presentation sessions. And I will give the floor to Mohammed to share his experience.
Definitely. One of the fascinating feedback that we heard during the conference, especially that we have attended, when we put the poster, like everybody was sharing, like how did you manage to get in partnership with all of these communities? And I would definitely give credit to Frankie and the team. It's not easy to do this kind of partnership, and it's not so the people at the conference, many providers, many specialists, many researchers shared that statistics are focusing on country of origin and the target communities that the prevention efforts should be focused on. But the missing part after that is like, how is that can be done? And honestly, like we were standing out among all of these posters and exhibitors at the conference, that we have moved forward with this step already, and we gave the power to the community. And during this time of partnership with community navigators, we have been in community places where traditionally it's not the common space for bringing awareness about public health topics like TB and other stuff. And as Frankie shared and the poster shows, like we have been into places that never been visited before, so like we were doing workshops at apartment complexes. We were doing tabling events at community faith places that are not really a place for such kind of outreach. In partnership with the community, we have built that kind of like extra level of trust and bridges that enable us to be present in these spaces. And the way we simplified the flyers and the content and the talking points and customized all of that culturally to be responsive to the cultures. And we, as a team, come together every month to share the challenges and what we hear from the communities, and everyone is sharing the common misconceptions that they hear in their communities. And we build and develop all of these materials and outreach information based on these stories and feedback that we hear from each individual community that we serve. Yeah, and I think that's one of the main messages that we are coming here today for, is to emphasize that the power of the community and the importance of building partnership, serving communities by the communities. So the pictures here, like if you see, we have Mary Rose, we have Emma, we have some other people, wonderful community. We went to these community spaces to do some presentations, to bring awareness about TB, and encourage people to do testing and respond to the concerns and the misconceptions that are promoted within the communities. Yes, Frankie.
Thank you, Mohammed. And that was like, Mohammed was also sharing a lot of what he came across during the poster sessions. With the like presentation sessions, there were 4 presenters that stood out to us, and all 4 are or were doing TV work that involves collaborating with community. First was Dr. Sheldon. Dr. Sheldon is a Marshallese doctor in Arkansas. And a highlight from this discussion was the need for healthcare organizations to understand the culture and history of their patients. His examples were specific to the Marshallese community, and he expressed that to be a better healer for the Marshallese community, you need to have the knowledge of the Marshallese community's history of war, colonialism, and nuclear testing. You also need to be aware of the common health issues that hurt the community. TB, for example, right? Testing for prevention or early detection are more likely to happen if their PCPs are aware that TB is common in the Marshall Islands. Second is Dr. Duncan. Duncan is a physician at Harborview in Seattle. His presentation echoed what Dr. Shelton shared. What was great about his presentation is that he talked about how he and his team on Ethnomed are currently creating products that have these cultural information for providers to use, specifically regarding TB. Their current work is to create these products or cultural profiles for the 17 communities we've been engaging. A third presentation was Dr. B, or Dr. Bergstrom. He and his team went to the Marshall Islands and Chuuk to provide mass testing and treatment. And they expressed that the success of the project was because they were able to train and include community members to join the work. And lastly, number 4 was by an EPI from New York. I was only able to join the end of their presentation. I left the other sessions I signed up for, kind of snuck away. I was just curious about what they had to present, and I think they presented about their active case finding project. What I remember from their presentation is that they highlight a need to include community. An example they used was somewhere along the lines of, imagine strangers randomly showing up and asking to draw your blood in a corner. This makes things difficult, very difficult, without having someone they can trust. And there were others that talked about the successes and opportunities of community partnerships, but these four stood out to us. Mohammed, is there anything that I might be forgetting to share?
You did also. I just want to add that I've been participating in one of the listening sessions that Dr. Duncan that did in the Arabic Iraqi community. His approach is really about listening to people and understanding the best approaches and the common misconceptions within the communities, to respond to that specific cultural challenges within the community and address that, and draft a material that targets specifically tailored toward the community. What I like during that session is that he was asking the questions and people were leading the conversation. I myself remember, the participants were sharing that, knocking doors, campaigns from public health in Iraq is led through different ways, not necessarily tabling, but maybe like radio spots or, campaigns where professionals come out, knocking doors and talk to people, sharing things with kids and bringing gifts and, starting a conversation in a friendly way and build the relationship with the neighborhood and coming back later with more information and things like that, but that helps, you know, uh, public health professionals understand what is the best way that we can do and approach this specific community. And I feel like this is a very, very important and significant cultural profile that help us as professionals to understand how we can approach this and that community in a cultural responsive way that accommodate the needs within the community. Thank you, Frank.
Essentially, these are like specific examples of why we feel working with community representatives or having a community mediator to engage community is very necessary. There are many reasons why community partnerships are important, and there are a few that we want to share with you today. First is that community partnerships allows for a broader reach of communities. As you may know, TB impacts many communities. The partnership we have with the Navigator team is to promote preventive TB behaviors. And not only are we engaging communities representing our local cases, but we are also including communities from other TB endemic countries in our outreach, right? We are actively trying to be inclusive. Also, as a government entity, it will be very difficult, like Mohammed said, for us to enter many of these spaces to engage community. But because of our partnership with the Navigator team, immediately we were sharing TB information like apartment complexes and other informal community gatherings, as an example. It would just take so much time to build enough rapport to be able to do that. Next is we are able to be culturally responsive in our outreach. We have access to folks with the cultural expertise to guide us. And then, they're also able to hear feedback or concerns from community better and share those with us, right? So one thing that we did was, we're doing an outreach and we're asking folks, ask your doctor about for a TB blood test. If it's a latent TB, ask for treatment. And then what we heard back from community after a short time is that folks were having trouble remembering what to ask specifically, like what are these different steps, right? So through, with the Navigators, we were able to co-create, co-develop these like cards, these like postcards that now we give at our outreach events. It's essentially for folks that are interested to start preventive TB care. They would give this to their doctor, and the hope is that their doctors will read this and see that the patient is interested in starting preventive TB care and has like a list of recommended steps from the TB team. Let's see. And then here's like other specific examples of how we're able to be culturally responsive, just meeting folks where they're at, sharing the TB information where through the different channels that they normally get information through, right? Like the first one, here's an example. We did a Facebook Live discussion with Spanish-speaking communities. This was more like a TV presentation with the Chinese community I believe at an apartment complex. And the Navigator was able to get us in that space to have this discussion with the community. Here's like, for some folks, they prefer posting stuff on social media. So for the Ethiopian community of Seattle, we co-create materials for them to use for social media. And then there's like various different in-person engagements that are done with the Navigator team, right? These are different tablings. And here, in this photo right here with Mohammed, you might not be able to see, but it's like him tabling at CMAR. Another thing that's valuable with community partnerships is that we have an opportunity to empower community. a specific example is Public Health Seattle and King County recently gathered feedback from different communities about priorities to include in their strategic planning. And one of the main things that community prioritize is the sharing and transferring of power to community. One of the messages in our outreach is for community to ask their doctor for a TB blood test, right? The problem is that many folks that are quote unquote eligible to and interested to seek preventive TB care have trouble navigating the system. So we have an opportunity to help folks gain that skill, which should result in having the confidence to apply these skills beyond TB and include other health priorities. For this, that we expect a spillover effect. We're hoping that this will increase, there'll be an increase in healthcare access through our outreach, improve cultural awareness among providers, which would then increase patient satisfaction and trust. A specific example, I think, is this flyer that was posted. I don't know if it was a specific Health Point clinic, but I think it was Mohammed that sent me this this flyer, and I think it's things like this that helps build patient trust and awareness. I mean, increase satisfaction if providers have this cultural awareness, and then there's improved health outcomes through all of these. The challenges we've been encountering and engaging community. The first is that TB as a topic for many communities is very difficult to discuss. And the reason varies across different communities. Through in-person discussions and work with the Ethnomed team, we've learned things like, for the Congolese community, talking to someone about TB is the same thing as saying they have AIDS. For the Iraqi community, having TB disease is believed to be a death sentence. And then for some, having TB means they did something wrong, right? So it's a very difficult topic to discuss with different communities. And fortunately, we have folks, community representatives, mediators that are able to help us and guide us with these discussions. The second thing that a lot of us are aware of is barriers to care. There's just a need to help community learn how to navigate the system, from applying for insurance, finding a doctor, what it means to establish care, understanding that specialized care might be at different locations, when to go to a PCP versus urgent care versus the ER. We are learning that it will be very difficult to address LTBI without supporting community with their own health priorities first. And then the third thing is resources. Really need sustainable resources to maintain relationships with these communities. Community organizations need to be a part of public health. And that concludes what we wanted to share with you today. Again, thank you so much for allowing us to be here and share about our work.